Earlier today, the former Secretary of Health and Human Services, Kathleen Sebelius, said that there was a way to fix Obamacare. She said, change the name. She said, change the name. That was her solution. And that's not something she just told a friend. It's something that she told many as she was participating in Politico's Lessons from Leaders events. Well, Madam President, leaders don't blame the failure of a bad product on a name. They blame it on a lot of things, but the name's not it. After all, the president said he was fond of the name Obamacare. Apparently, Kathleen Sebelius is taking a play from the playbook of Professor Gruber about underestimating the intelligence of the American people. This law isn't unpopular because it was named after the president. The law is unpopular because it doesn't work. It's unpopular because it doesn't deliver what the president promised the American people it would. So Democrats can rename this healthcare system whatever they want, and people all across the country are still going to know that the law is failing them. People have been hit by higher costs, higher copays, higher premiums, higher deductibles. Many of them can't continue to see the doctor that treated them in the past. So no matter what the Democrats and Kathleen Sebelius want to call it, the law remains very unpopular because it is unworkable and it's unaffordable. So, Madam President, as we head into the middle of December, next week, December 15th, is the deadline for people to sign up on healthcare.gov if they want to have their health insurance coverage starting next January the 1st, just a few weeks from now. Now, that's for people living in the 37 states that use the federal health care exchange. Now, a lot of people still haven't signed up, and they may learn over the next few days, if they do go to the website to sign up, that their health care and their insurance premiums are actually more expensive next year than they were this year. That's what people continue to see, health care rates going up in spite of the president's promise. You know, when President Obama was selling his health care law to the American people, he promised them they would save money. He actually went so far as to say that people would save $2,500 per year per family under his plan. And Nancy Pelosi, the former Speaker of the House, she actually went on Meet the Press. And at one point she said everyone's rates would go down. Everyone's rates, she said, would go down. Well, that didn't happen. Now the Obama administration finally admits that people are paying more, not less. Americans buying health insurance through the federal exchange will see their premiums go up, and the administration finally admits it. Now, that's according to a new report by the Department of Health and Human Services, came out last Thursday. Democrats said prices would go down. The president promised they'd go down. Nancy Pelosi said down for everyone. Instead, the prices keep going up. Here's what one person in Syracuse, New York, wrote to his local newspaper last week. Lawrence Petty wrote to the Syracuse Post-Standard last Monday, December 1st. He wrote that he has a plan he bought through the state Obamacare exchange. This year, the cost was about $664 a month for the couple. Next year, going on the exchange, the rate for the same plan, because the president said, you know, if you like your plan, you can keep it, for the same plan is going up from $664 a month to $773 a month. That's over $1,300 extra a year. He asked the newspaper in Syracuse, New York, so what gives? The average increase across the country is less than that, but this man in Syracuse, New York, is looking at a price hike of more than 17%. Every Democrat in the Senate voted for the president's health care law, every one of them. The Democratic senator from New York voted for the health care law. It's the very state where this man is writing to his newspaper in Syracuse, New York. What do they have to say to this man in Syracuse whose insurance premiums are going up 17% next year? How do they respond to this man who is writing to the paper in New York, What Gives? Maybe his question has something to do with what the senior senator from New York said a couple of weeks ago at the National Press Club when he admitted that the health care law, in his words, wasn't the change we were hired to make. And Madam President, it's not just premiums. They're not the only problem here. The health care law has added so many Washington mandates, so many things that people didn't want, can't afford, aren't interested in, don't need, that other costs have gone up as well. That includes the money people have to pay out of pocket for things like copays, their deductibles. Now, some people have actually had to delay their medical care because of all these additional expenses. According to a new Gallup poll last month, 33% of Americans say that over the past year, they've put off getting medical treatment because of the cost. Now, Gallup's been asking this same question all the way since 2001, well before the health care law has ever been passed. And this year, it is the highest number ever. And this is after the president's health care law has been signed into law and has taken effect, and the exchanges are in effect. Highest ever of people not getting care because of the cost. Those people, 2/3 of them say they have put off treatment for a serious condition. One of them is a woman named Patricia Wanderlich. Now, she's 61 years old. She works part-time at a landscaping company outside of Chicago, the president's home state. She told the New York Times that she has a small brain aneurysm that needs monitoring. She tells her story in an article the New York Times published on October 17th under the headline, "Unable to meet the deductible or the doctor." Patricia has a health insurance plan through Obamacare that has an annual deductible of $6,000. So she has to pay for most of her medical expenses up to that amount. Because of that, she says she's skipping this year's brain scan and hoping for the best. She says a $6,000 deductible, that's just staggering. This is the kind of person that Obamacare was supposed to help. And changing the name of Obamacare, as Kathleen Sebelius has recommended today, isn't going to solve the problems for this patient with the $6,000 deductible. She got the insurance, she got the coverage, but she still cannot get care. And that is a fundamental problem with this health care law. The other thing this New York Times article points out is that people can't meet their deductibles, and they also can't meet their doctor. Patricia told the newspaper that if she switches to a policy with a lower deductible next year, well, she's going to get a smaller network of doctors, which means she'll lose access to the specialists who are taking care of her. A lot of people are finding that they're in the same situation, losing access to their doctors. Sometimes it's because the insurance has these narrow networks of health care providers. Sometimes it's just because the doctors are so overburdened that you can't get an appointment. There was an Associated Press report that came out over the weekend. The title was, "Health Law Impacts Primary Care Doc Shortage." Health law impacts primary care doc shortage. Now, we already knew there was a shortage of primary care doctors in the country, also a shortage of specialists, also a shortage of nurses. The president's health care law has made it worse. The Associated Press article quoted an insurance agent in California named Anthony Halby, who says that he had clients tell him that their Obamacare plan made it extremely difficult for them to find primary care doctors. As he says, coverage does not equal access. He's advising his clients to skip Obamacare next year and pay more for insurance with a broader network so that they can at least get to see the doctors that they want, the doctors they choose, the doctors that they need. He tells people the premiums are going to be higher because there's no subsidy. However, it's going to guarantee you actually get to see your doctor and keep your doctor. So people are finding that they're paying more when they were promised by President Obama, by the Speaker of the House, Nancy Pelosi, that they would pay less. But she's the same one that said first you have to pass it before you get to find out what's in it. So people are having to put off care that they need because Washington says they have to pay for things they don't want, they don't need, and they can't afford. People are finding out that the coverage isn't the same as care, and millions of people are finding out they can't meet their deductible or their doctor. That's not what the American people wanted from health care reform. People wanted access to the care they need from a doctor they choose at lower cost. That's what they wanted. Instead, what they got are all these new Washington mandates, all these new expenses, all these new problems. But what was the president's solution to that? Well, he said, put more people on Medicaid. He told governors around the country, expand the Medicaid program. Make sure people have gotten on Medicaid. We know that that is a system that has been broken for a long time. And the question that we continue to ask is, can somebody who's gotten a Medicaid card printed up and given to them or sent to them, can they actually see a doctor? Department of Health and Human Services says, oh, don't worry about that. Well, what did the Inspector General say this week? Yesterday, New York Times. Yesterday, New York Times, half of doctors listed as serving Medicaid patients, this is by Health and Human Services, half of doctors listed as serving Medicaid patients are unavailable, investigation finds. And who did the investigation? The Inspector General of the Department of Health and Human Services. So even though Health and Human Services says, oh, all of these doctors are available to take care of Medicaid patients, their own Inspector General within the department says, not true. Not true. Only half of the doctors listed as serving Medicaid patients are available. That's what we're dealing with. That's why Republicans are going to vote to repeal the entire health care law. Meanwhile, we'll also vote to strip away the worst and most destructive parts of the law. Things like the arbitrary 30-hour work week. It's been damaging to part-time workers across the country. Things like unfair medical device tax that sends American jobs overseas, threatens life-saving innovation. Look, Republicans are going to talk about finally giving people choices. That's what people want with health care. They want choices, they want availability, they want affordability. That's what they're looking for, available, affordable care with choices, not more Washington mandates. And finally, giving access to the health care that people really wanted all along. So Kathleen Sebelius may come out and give a lecture and lessons of leadership, changing the name of this health care law from Obamacare to anything else isn't going to make it any better for the people across this country who are finding out that the president's promises were empty promises, that they have been intentionally deceived as the way that this health care law was presented and passed, and now they find out that their insurance is less affordable, their cost of care is going up, and the availability of that care is going down, and they have lost their choices. Thank you, Madam President. I yield the floor. Suggest the absence of a quorum.